Okay. All right. Hello, everyone. Dr. Rich Castellano here, the Smile Doctor. We are getting started, and we're here today with Leslie. Leslie, thank you for allowing us to share your video and do some teaching today. So we're going to be doing a lifting procedure, mini lift with the laser lipolysis and upper eyelids. We did some of the fillers already, and Leslie, who is just taking such great care of herself, parents living to well into they're in their 80s now. 90s. And so here we are from the beginning. A+ student looking for extra credit. We're going to refresh smile lines, and Leslie does not want to wait until, and also we're going to do the upper eyelid. She does not want to wait until there's advanced staging changes. Hello, Carmen. Thank you for watching. Thank you for sharing. Okay. And we were talking earlier about Leslie's reasons why. She just doesn't want to wait, and she wants to be ahead of the game and she is in good shape, taking good care of herself, many active and useful years ahead of her yet. And it's an honor to be a part of her life and help her with this important step in looking and feeling her best. Okay, very good. Thank you for watching. Thank you for sharing. If you're just joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. I'm going to be doing some of the tumescent solution. For the lifting procedure, I use the Avogard cleansing foam, putting on sterile gown and gloves. Ari has everything set up perfectly for us, makes it very easy, so make sure you're following facebook.com/ImageLift, and also on Instagram, ImageLift Now, and YouTube. Let your friends know these are live awake procedures. We're the #1 in the world for live awake facelift procedures, because the technology is amazing, and it's really the best way to teach. There's no filters, there's no editing. We have doctors and students all across the world, patients from all across the world.
Doctor, you might need to zoom the last one.
Yeah, that's fine.
It's
just a still video.
Oh, okay.
Everything's looking good, and we're off to a great start. So now that we've done some of the Sculptra, and how was the Sculptra overall, Leslie? Not too bad?
Oh, not at all.
Okay, so we did the Sculptra, and as we say, you see a little bit of volume from that immediately. It goes away completely, and then the collagen builds up. That's fine. I'm going to turn your chin all the way up, and I like to start. This is 2% because she's doing the mini with the laser. The 1% lidocaine with 1 to 100,000 epinephrine. Yes, this is the same person from the last video. A little pinch, 1, 2, 3, pinch. And a little bit of numbing medicine, and then we'll do the tumescent solution. The tumescent solution for the physicians and students that are watching, it's made up of lactated ringers, bicarbonate, epinephrine, and lidocaine. Feel a little pressure pinch here. Pinching, pressure, or a little bit of both. Not too bad.
No, not at all.
So some numbing medicine, and we've given her the Valium and the relaxing medicine, so it feels like she's had a few cocktails. And if she needs more, we can always give her more. So when you use subcutaneous tumescent solution, you feel a little pinching there? Not too bad?
No.
Hello, Carmen. Thanks for watching. Hello, and thank you for sharing. So it is amazing how with technology and activities and health that people are living active, useful lives much, much longer. And that's a wonderful thing. And of course, pinching here.
No.
Now, one of the things I do for my facelifting procedures, I will normally use a 5-ochromic for closure of the skin. And when patients have more pigment in their skin, then I'll use a 5-o-proline. And those are stitches that we'll take out either at the 1 or 2 week visit. And what I found is it does a better job for the incision line. Okay? Yeah. Thank you. And for tomorrow, too. Someone was asking, thanks for asking, Cheryl, should dental work be done before you do a procedure like this? You know, if it's urgent, then do it, but it's not mandatory to do your dental work before you do this. Now, immediately after the lift, you feel a little pressure pinching there?
A little, yes.
Immediately after the lift, for the first week or two after the lift, you will feel it's a little more difficult to open and close your mouth. That's just because of the tension and tightness. So that's normal. That will go away. So Everything's looking good. So you can do your dental work really at any time, but you do it before, or if you're going to do it afterwards, give yourself 2-3 weeks after, um, just because it's a little easier to open your mouth, but it's not a strong contraindication. It depends on the dentist, and it depends on the person. Everything's looking good. So the tumescent solution is a part of the dissection. It lifts up the skin away from the deeper structures, makes it much easier to do the procedure. Perfect. So now we're going to do some numbing on the other side. I'm going to turn your head all the way this way, nice and easy, and a little bit more. That's perfect. Now, when you're injecting with the tumescent solution, if you inject, as you inject, you will see the skin will plump up, or as we call it, tumesce. Now, if you follow that fullness, you'll keep your needle in a very safe plane that is very comfortable. You might feel little pinches, but not big pinches. So that's an important technique to stay subcutaneous while you are injecting the tumescent solution. Okay, very good. Thank you for watching. Thank you for sharing. We will also be in Vegas in July at the Aesthetic Show. Looking forward to seeing you there. I was talking to Dr. Perron this morning, texting with him, and he was telling me he's going to be out there too. Look forward to seeing the doctors and faculty out at that meeting. Pressure pinch. Perfect. All right. Now, the other benefit of the tumescent solution is that the epinephrine, you feel a little pinching there?
Mm-hmm.
The epinephrine causes the blood vessels to shrink, so you'll see a little lightening of the skin just temporarily where the epinephrine is taking effect. And of course that helps to keep the medicine in the place where you want it a little bit longer, and it helps to reduce blood flow, and that's less bleeding, which is a good thing for the procedure. The numbing medicine lasts for about an hour after we're done, and we have patients take their pain pills. Some people only take Tylenol, some take all of the pain medicine, but most patients will take the pain medicine for a couple of days afterwards and then taper over time. Very good. If you have not downloaded our book, you can go to Amazon and see. We guarantee we can make you look younger. 27, please.
Mm-hmm.
And the Smile prescription. And thank you very much to my team, Ari and Nina. They've got everything set up perfectly. And Charlene, let me turn your head this way a little bit. And it's Lainey's birthday today out in our village's office. You feel a little pinching through here. Pinch. Pinching. Just at the USF Medical Alumni meeting recently, and that was fun because the new USF College of Medicine is going up, really exciting, and then the alumni weekend. If you're a USF alumni, it's coming up second week in October. Perfect. A little pinching here. And then I numb directly where the incision will be made, and also in the anterior aspect of the dissection area, okay? So now that we've done the numbing, we'll switch sides. Let me turn your head this way, nice and easy.
Mm-hmm.
And 27 gauge, please.
Yes.
Leslie, how are you doing, dear?
Perfect.
Pinch. Now, you did not watch any of our videos for procedures before.
No, I didn't.
Are you going to watch your own video?
I just might.
Well, now you've got it. It'll be out there so you can watch. And everything's looking good. Pinch. Now I'm going to draw on the eyelids. So what we do for the eyelids is you start out, let me turn your head this way, by marking the eyelid crease, right? And you'll feel my fingers here.
Mhm.
And as you mark the eyelid crease, mark it out to the sides of the eye, then I do a little bit more medially, and then I'll do about 15 millimeters lateral to the last eyelash to help get some of that hooding. So in the eyelid crease, the eyelid skin is very forgiving, and it's the thinnest skin in the whole body, so it's a little more prone to swelling. And then I'll take a smooth forceps, and what I can do is if I pinch the skin, it shows me how much I can remove without, while still allowing her to close her eyelid. And that's key. And once or twice a year, I'll have a patient, I'll bring them back to take a little extra skin. It's always better to come back another day and do more rather than go too far. Perfect. This is a one stitch technique for the eyes. So patients really love this technique because it's less recovery. You leave the muscle, you leave the fat. Less discomfort. And so if patient has really heavy eyelids, then we can sometimes take the muscle or fat. I'm going to turn your chin all the way up. 15. Everything's looking good. So we're doing a mini lift procedure under local anesthesia with laser lipolysis. Leslie, we're going to put these little eye shields here. So your job is just to keep your eyes closed, number 1. Number 2, this is our 15. Number 2, we have the eye shields. And number 3, yes, that's fine.
Okay.
Number 3, we only activate that laser when it's in a safe place to do so. Someone had asked about the cost, and the cost of the procedure is, you can look at imagelift.com/pricing and see it there. Or give us a call, 813-463-9245. So this is the helium neon beam, that's the guiding beam, and this is an ND-YAG laser, 1064-1320. How's that, exactly? Okay, there you go. Okay, so what I do is when I'm delivering the laser energy, we make the little insertion point. And now that we're subcutaneous, you hear a series of little popping. Now, this can break up fatty tissue. Leslie really doesn't have a lot of fat to speak of, but what it does do is it will, that's perfect, that's fine. What it does do is it helps to tighten the skin by creating a thermal injury underneath. I think we're all set. We got phone numbers, and then for tomorrow, do we have the goodie bag and everything?
Yes.
All right. And you hear the little popping, that's each time the laser is activating and it breaks up fatty cells, or it basically creates a little micro explosion of the steam heating up the tissues, creating that popping noise. So it's a little tight here. Can you want to bring that a little closer so that it's not so tight? There we go. When you're using the fiber optic or laser lipolysis, you want to make sure that you are not kinking the laser lipolysis at any junction of the apparatus. So that way, if you we keep extra fibers, of course, but if you kink it too much, the fibers will break and then it's just not going to work. So really important to not let it kink. The kink points are most common at the end of the handpiece or when it comes right out of the machine, because those are areas where if it pulls really tight, that's where it's most tethered. So if you run laser lipolysis, those are things to think about. for training your staff. Everything's looking good. For those of you just joining, we're doing an image lift, mini lift under local anesthesia, laser lipolysis. Leslie's doing great. She's in her early 60s and many active years ahead of her, but she does not look like she's in her 60s. Parents in their 90s, very active. She's got good genetics and she's got an even better smile. Everything's looking good. How are you feeling, Leslie?
Great.
Very good. Perfect. Thank you for watching. Thank you for sharing. I measure the amount of energy from the laser lipolysis by the heat I feel with my hand. I also measure the amount of energy that comes from the device. I can see that. Right now we're at 2,900 joules. And Ari, you'll see that little red dot that goes over top. That's our external temperature gauge. We monitor oxygen, we monitor heart rate, we monitor blood pressure. But the most important thing we monitor is the patient, and we just ask, Leslie, how are you feeling, dear? It doesn't get much better than that. If you're hearing good news from the patient, she's doing fine, then everything's good. If the patient feels uncomfortable, they'll tell you. And when you're under general anesthesia, they can't do that. And if you're under, some patients tell me they've been under general anesthesia 4 to 8 hours to do facelifting procedures. I mean, that's just too much, and it's not necessary, and you can get positional injuries. Today, patients don't want more extreme treatments. Everything's looking good. Thank you for watching. Thank you for sharing. Perfect. So again, this is subcutaneous plane. Above the SMAS layer, the SMAS stands for subcutaneous musculoaponeurotic system. It is a fascial tissue layer that envelops the facial musculature. And when you tighten it laterally in front of the ears, or as we say pre-auricularly, it tightens up the neck and jawline. Everything's looking good. When we're done with the procedure, we'll show you we put a wrap on, and we will walk Leslie to her car, to her driver. Because she's had the relaxing medicine, she can't drive. It's like she's had a few cocktails. And then we'll see her tomorrow, 1 day, 1 week, 1 month. I give my cell phone out to all my patients. Everything is looking good. Thank you for watching. Thank you for sharing. Make sure you share with your friends, because they're going to be amazed and they're going to be upset if you don't share. If you tell them, oh, I was watching live surgery on Facebook or YouTube or Instagram, you say, well, why didn't you share with me? They want to watch it live too. It is pretty amazing and fascinating what the latest technology can do. It's definitely different than what I did when I was in my training. Did a lot of great things in my training, but now with the ability to do it under local anesthesia and laser lipolysis and adding these fillers. We just had some of the collagen when I was doing my training. They just came out with Restylane back then. That was a big deal. And so now we have many fillers to choose from. And there's more. There's another Botox coming. And temperature, please. Very good. Thank you for watching. Thank you for sharing. It's an honor to be the #1 live facelift surgeon who does live videos on awake patients. And as you can see, you don't need general anesthesia, you don't need IV sedation, and you don't need a full traditional facelift. Leslie, how are you doing, dear?
I'm fine.
Perfect temperature, please. You're the highest. As I'm putting As I'm putting the cannula in the subcutaneous space, I'll feel some of the fibrous attachments that connect the skin to the deeper structures, and I'm lifting those. You can come through those. It allows them to reset and refresh that scar tissue collagen layer. Perfect. Everything's looking good. Temperature, please.
36.
Very good. Everything's looking good. You're gonna love it. It is important to update patients and let them know. Okay, we're done with the laser lipolysis. I'm gonna have you turn your head all the way this way. So, before you switch your gloves, when you take those off, can you just swipe this up? Swipe that up on this one. So this one, just swipe it up. No, this, the alert. You swipe it up. There you go. This one and that one same. Swipe it up, and then this one up. Perfect. Okay, that's fine. That's fine. Leave those alone. This one too. Swipe up. Perfect. Okay.
Good.
So now I use the 15, and then I also use the fine tooth, and that allows me to lift the skin. Okay. So the 15, perfect. And this is what we call the hair-sparing incision. Do you feel a little pressure here? Any pinching at all?
Very little.
You feel pressure? A little bit of a pinch?
Very little.
So if I hear that, then I'll put a little touch of the numbing medicine, just to make sure, extra sure. A little numbing. Perfect. Now this is what we call the tragus. This is the piece of skin that's right before the ear canal, and the importance of the tragus is that's from the Latin word root, like goat, like a billy goat's chin, and you want to recreate that correctly so that way it looks very inconspicuous, that you can't tell that a lift has been done. Okay, ear forward for me, please. Thank you. We have an outside consulting firm. They monitor all of our safety practices. Thank you to Universal Healthcare Consulting. You always want to be raising your standards. Very good. We had one of our patients come in today who was Ehlers-Danlos, and what a nice result. You're not supposed to be able to get good results on Ehlers-Danlos, but we did get a nice result, and we'll have more videos to share and follow up with that. And right now this is the dermal layer. You know, if you scratch your knee and you see like a little white on your knee or your skin, that's the dermis. The dermis is whitish because of the collagen. Collagen is white. Perfect. Leslie, are you feeling any discomfort at all?
No.
Okay, good. Me neither.
Oh, good.
And I tell patients if they need to bend their knees while they're doing the procedure or adjust, we adjust their position so that they feel comfortable. We're in Tampa and in the Villages, Florida, and this is the bipolar cautery. Perfect. Very good. Okay. So a little bit of cautery, and then traction, counter traction. People say when you did your first facelift, you must have been very nervous, and I still remember my first facelifts. That one of the fellowship directors that I was working with had said, well, Rich, if you want to bring a patient to the clinic and then do the procedure, just have them cover the anesthesia expense, you're welcome to do so. And so the first nurse that I told, saying, hey, if you know someone who needs a lift, she says, I'll do it. She knew me, she trusted me, and she knew that the fellowship director would be supervising. So we did the lift. She's very happy. She moved to Florida. That was in Indianapolis. She moved to Florida later. We've been in touch, and she said the neck's still holding up. And for that, that was done more general anesthesia. Now we do a lot more of the local anesthesia procedures. Perfect. And as you can see, there's really very little bleeding for what we're doing. Thank you, Ari. She's anticipating all my needs. I use my left and right hands to do the procedure. So traction here, counter traction with the tips of my Cons facelift scissors. And you're just making little tunnels through here. Tunnels, make tunnels side by side, and then you connect the tunnels. So this is a SMAS plication. I've done imbrication where you lay the SMAS layer over top, and they're all good techniques, but I modify it based on patient goals and the anatomy that we see. Ear forward for me, please.
Sure.
Everything's looking good. Thank you for watching. Thank you for sharing. Thank you. Everything's looking good. How are you feeling, Leslie?
Oh, fine.
Very good. Now when Leslie's here, I can literally see every time she takes a breath. I know it. I can even see in her neck, I see the pulse from the vessels. You can see it right in through here, just the little heartbeat. Plus we have the pulse ox monitor, so there's no substitute for monitoring your patient. It is necessary and mandatory. Very good. Release for me, please. So once you elevate, even just a little bit of, as we call this as the blunt dissection, it's a very powerful way to get a nice, even exposure. And as you feel the tissues, you can feel, are there any areas that you need to release? or lift up. Can you elevate that for me, please? So now I use a 2-0 Merceline, or also known as Ethibond, for the deep suture. I grab the SMAS layer, and I can see there's a fair bit of laxity, but we're going to help that. And as I grab some of the SMAS and I pass the suture distally, or towards from the jawline to preauricular, right in front of the ear. And then I'll take one more pass through here towards the cheek, and then back again towards the ear, preauricular. And then I bring that together. And Ari has everything set up perfectly, makes it very easy for me. Thank you, Ari.
You're welcome.
Everything's looking good. Thank you for watching. Thank you for sharing. So once I put tension on that knot, we flash the suture right there with the needle driver that holds it into position, and then I'm cinching that knot down. When I go back and forth like that, just really, as we call, throwing down the knot. Surgeons throw down. And this stitch, the knot gets covered in scar tissue and stays where it is. Occasionally it can surface like a splinter. If that happens, that's easy to take care of. And then this is an infraauricular suture underneath the ear. Very good. Double throw, cinching things down. Hello, Sonia. Thank you for watching. Yes, so costs are at imagelift.com/pricing. We like to use the Build My Body price estimator. It has been effective to help our patients get the information that they want, and gives us their information as well, so we can be in touch with you for those who are interested. Price transparency is a good thing, letting people know what your pricing is. This way, it sets their expectation ahead of time. And then I like to use a 2-0 Vicryl for preauricular SMAS plication. So that is a little bit closer to the cheek than preauricular. And a little closer to the cheek, and then preauricular. This suture will stay in place 4 to 8 weeks afterwards, and by that time the scar tissue is set and you don't really need the suture there. Very good. Thank you for watching. Thank you for sharing. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Now, once I've done the tightening, you can see there's tiny little dimple there. Well, I can release those dimples by just undermining. So if you see a dimple, you undermine, and those things, even if I left them alone, they would just fade, but I like to take care of them right now. We're here. Might as well do it. Make it as good as possible while you're here, and then let the healing process take its course. So I'll do a little bit more undermining through here. So now you see all this extra skin. So we're going to remove this extra skin. We figure Leslie doesn't want it anymore. How are you feeling, Leslie?
I'm good.
So when was the last marathon you ran? Or your your aunt is running them? Who runs the marathons?
My cousin.
Your cousin.
Mm-hmm. She does the triathlon.
Wow, that's amazing.
She's in her 80s.
Wow, in her 80s. That's just unbelievable. No excuse. There's an 80-year-old running.
And biking and swimming.
And biking and swimming. My goodness. That's amazing.
lazy. I'm the lazy one.
Oh yeah, I don't think you're so lazy. You're pretty active. Go ahead. Everything's looking good. We will be rebroadcasting soon, so make sure you are following. So in the post-auricular area, you see all this extra skin that we've got here, and we're going to trim that. Perfect. Release, please. Now a little bit of bipolar cautery. Very good. Leslie, are you feeling any discomfort at all, dear?
No.
Okay, good. If you're not comfortable, I'm not comfortable. So we're always checking to make sure the patient's comfortable. Your shoulder's doing okay?
Mm-hmm.
She was a little stiff on her shoulder, so we put a little cushion under there, and she says that feels fine, and that's all it takes. If you just do a little readjustment, make sure they feel comfortable, then you move on with the procedure. Some doctors will say, well, gosh, you really can't do your procedure if patient's moving or they're awake, or what if they don't sit still? If you give them the relaxing medicine, they sit still. If you position them correctly, they do sit still. There are doctors that do breasts under local anesthesia. All sorts of procedures can be done under local. It's definitely the way to go if you can have it done under local. Safer, less risk. Very good. Yeah, someone asked the price. You can go to imagelift.com/pricing, and the price is there. You just got to put your information and let us know what you're interested in, or give us a call during business hours, 813-463-9245. Now I'm doing the 2-0 Vicryl again. These are deep stitches, which means deep dermal sutures, which means the knot is on the bottom and is much less likely to surface. So sometimes a knot can come out of the skin like a splinter. If that happens, it's easy to take care of, but if you do your stitches deep enough, then it's just not an issue. But it still can happen. Okay. Perfect. Very good. Thank you for watching. Thank you for sharing. We will be rebroadcasting in a little bit. So make sure you're following so you get the updates. I'm going to set this right over here. Yes, we're doing a facelift, Inga, under local anesthesia. Thank you for watching. It's not a traditional facelift. There's no surgical staples, no surgical drains that are needed for this. Perfect. So cinching this down. Very good. Thank you for watching, and please do share. It's very kind of Leslie to share and allow us to demonstrate her procedure so others can learn and ask questions, and patients will say, wow, that's definitely, I would prefer to do that than a traditional facelift, but some people will say, well, that's not for me, and that's great. So now you know, if it's not for you, you've seen it firsthand. You can read all you want about it and see all the marketing materials, but until you actually see the procedure, there's nothing like that to demonstrate what we're doing. So, very proud to share and teach. The root word of Dr. Docere is to teach. So we are teachers. Hello, Vicky. Thanks for watching. The pricing, you can go to imagelift.com/pricing, and the pricing is there. You just have to put your information in and what you're interested in, and it will give you the pricing. Very good. So now I'm going to use a 5-0 proline, and just checking these areas look really good. I'm going to remove the eye shields here, and you'll feel a little pinch, numbing medicine on 3. 1, 2, 3, pinch. You feel big pinch, little pinch, not too bad. And you'll hear Leslie, her lips can sound a little goofy. That's because of the numbing medicine. The numbing medicine causes the lips to feel a little goofy. They move a little strange. I'm going to turn your head all the way this way now. That's perfect, just like that. Thank you very much. Very good. Thank you for watching. Thank you for sharing. Perfect. I'm going to turn your head just a little bit more this way now. Pinch, 1, 2, 3, pinch. If you're interested in a consultation, you can send us your pictures or give us a call, 813-463-9245, and you can learn imagelift.com. But make sure you're following on Facebook, facebook.com/imagelift. We're also on Instagram and YouTube. Perfect. I'm going to turn your head all the way back this way. That's good. And I just like to check this one little area. Very good. Tenotomy. So now I'm reshaping the tragus. Make sure that there's plenty of tissue. You don't want to, as we call it, blunt the tragus. You want it to have a nice shape to it, as it does, and a nice cuff of tissue around the ear so that the earlobe is not drawn. That's exactly what we want. 5-0 proline, very tiny, almost the size of a human hair. And the stitches that we put in are about 2 to 4 millimeters apart from one another. So very tiny little stitches. One of my patients who is a dentist, he's a retired dentist, his wife had the procedure done, and he was watching it on live video. He says, wow, you put a lot of very fine little stitches. So you get the hang of it after a few thousand. I think I've done over 1 million stitches, just adding up all the facelifts, 4,000 facelifts under local anesthesia and eyelid procedures. And Very good. Thank you for watching. Thank you for sharing. So stitches about 2 to 4 millimeters apart. We'll assess these stitches if they're ready to come out at around a week, 10 days, 2 weeks max. And then same thing with the eyelid stitches. This is a running continuous suture. We've already done the deep sutures. Perfect. Very good. Now we're stitching around the tragus. Yes, we're doing a facelift procedure. Hello, May. This is under local anesthesia, the image lifting procedure. Thank you for watching. Thank you for sharing. We're in Tampa, Florida, and in the Villages, Florida. Everything's looking good, and Ari and Nina and Charlene have everything set up perfectly. Thank you, Ari.
You got it.
And the rest of our team, we couldn't do it without them, with Mindy,
Stephanie,
Stephanie, Violet, Thomas, Ginger, Sylvia, Carmen, Jennifer, Courtney, and Lainey,
Sean.
and Sean. Perfect. Stop. A little tiny knot here. I'm just going to undo this. There we go. It's a very thin suture, so if you're not let it go, if you're not careful, it can just catch on itself, which is fine. If I need to get another stitch, I'll get one. But this one's just fine. Very good. Okay, so I do a lot of extra knots for this is a nylon type purling suture. Okay, now I'm going to turn your head all the way to the middle and a little bit more to the local just to
Okay.
test. Now, do you feel a little pinching here? A little pinch? Not too bad? Feel a little pinch or not really? Pressure more?
Just a little pressure.
Okay, everything's looking good. So the 15, the whole pressure, traction, counter traction. This is the tenotomy. So I grab with the fine tooth at the corner, the apex of the wound as we call it, and trimming the skin here. Just enough, but not too much. A little bit of bipolar cautery. Thank you for watching. Thank you for sharing. So just painting across. As you can see, there's really minimal, significant bleeding. Perfect. Back to the 5-O-proline. And this is a running subcuticular suture, so externally into the apex of the suture, into the dermal layer. And now I'll go back a little bit so it just kind of closes this under a tiny bit of tension. She's still able to fully close her eye. It'll feel difficult to close the eye while it's swollen with the numbing medicine, and then that goes away. So when the eyelids are swollen and they're healing, the tear function is a little different. It's perturbed, and you'll have a little dry eye sensation where you can take ointments or use the drops to keep your eyes moist. The goal with the eyes is to stay shiny. If the eyes look dry, then you reapply. Reapply that ointment. Moist wounds heal the best. Very good. Leslie, how are you feeling, dear?
No, fine.
Perfect. All right. Release, please. Okay, so as you can see, we easily draw that suture through and then a little loop, grab the end and then draw it tight, and that's one little tiny knot, which most people are very difficult to see, and if you we're readers, then it's really hard to see these little sutures. That's perfect. I like to leave just a tiny tail. Very good. Yeah, we're doing a facelift under local anesthesia. We did upper left. That's the one stitch technique, one stitch all the way across. So thank you all for watching. We're going to be rebroadcasting here in just a little bit. And Leslie, how are you feeling, dear?
Pretty good.
Yeah, you see her neck and jawline there, and we trimmed a little bit of the eyelid skin. Here's her before pictures. So you can see this is where we started, and she looked amazing before. Just wanted to tighten up the smile lines. And of course, you don't see the final result just yet because she is a little numb and swollen, and we want to improve, see how the smile lines soften. So congratulations. We're going to do the other side. We'll see everyone in the next video.